none of us, and this is, going to start into the question of like, why do we have insurance to begin with? And how did we get here from the insurance lens?
Hmm.
This one example explains it pretty clearly that like none of us, most people don't have $150,000 sitting around, where they can just pay for that service and not be in financial trouble. That's going to cause bankruptcy for most Americans. And so, as a society, just naturally in the private market solution to this is, well, you could band together into this concept called insurance. We can pool our risks together. We all pay. We flatten out that expense because only like 20% of the people are going to have high costs, so that we can subsidize it with the other 80% who won't have a high cost, level it out. And now we have kind of a modern way of paying for these very expensive type of services, like, say, saving someone from a heart attack. So that's the first thing. And that works pretty well. Like, you don't really even have to have that many people pool money together for statistically that to work out well. You probably need about 10,000 people. So this is actually something that you can solve on a kind of a low, even like local level, like just in an organic way. But then we always have problems with that arrangement. If you have 10 people, you're going to have a few that are too poor to afford that cost, and they can't pay that monthly amount to enter these risk pools to get access to that. You're going to have elderly people that are no longer working and they're not barely even taking care of themselves. They need their family to take care. They can't enter these kind of contracts in private insurance. And then you're going to have the really sick. I'm already sick. I can't get access to an insurance product because the people are going to be like, yeah, if you come here, you're going to explode our costs, right? And so you always have these kind of three problems where for 80% of the people, the private market solution of insurance, and Cameron, you alluded to it, like the pre-Obamacare days when, insurance companies and these risk pools that are organically in the private markets can create rules to keep, you have to be healthy to start off, right? Um, that keeps the cost low. But then as a society, you have these outliers. What do you do with the 20% of the people that can't get access to insurance? The sick, the elderly, and the poor, right? And so as a society, we have slowly over time in the last 50, 60 years, as our healthcare system has modernized, come up with government solutions for these, right? So for the elderly, we came up with Medicare. So let's get them on a federal Medicare program that covers everybody at the age of 65 and above, and you pay taxes all your life to go into that. Okay, you saw that little bucket. Then you gave Medicaid. If you're low income, the state government, the federal government, we kind of split the cost. Let's get the low income people onto essentially free coverage at the state level. We've taken care of the poor people. And then the sick people, we came up with this concept of guaranteed issue. Insurance companies can't cover pre-existing conditions or can't exclude pre-existing conditions on the Obamacare marketplaces. Now these people can have access to this coverage, and the federal government throws a bunch of subsidies at that market to kind of cover that cost and make sure that risk pool is big enough to kind of take care of that, right? And so we have created a system that has tried to solve the problem of what do we do with those 20% of people that can't get access to organic private market health insurance on their own, which is a good thought. The question is, like, was it the right solution in all of these cases, right? But that, and I think what Americans have yet to fully realize is what that has done. It has split how Americans interact with the healthcare system into like three very different buckets. So I'm going to go back to the question. The original question is, healthcare costs too much? The answer is actually we don't know, because 40% of Americans today, again, trying to solve this problem of how do we take care of the people who can't get access to insurance, we've in a sense overcorrected, and 40% of Americans have direct federal or government-based insurance. 40%. 95% of Americans have highly, highly subsidized health insurance. So most of us get our insurance from our employer, who pays over 80% of the premium on average, that covers most of the cost.
For the employee.
So for the employee, yeah,
Yeah, thanks.
which is, yeah, for the
Some
employee.
family. some families listen to this like they don't cover 80% of my family coverage, but yes, for the employees coverage, they have to cover 80%.
for the premium,
Yes, for the premium,
right? And so you still have cost sharing and all these things, right?
100%.
Like so so I would say that there's a couple things to understand is that, and this is back to like your free market economic reality, which is the government programs. Again, 40% of Americans are price controlled programs at the federal level, meaning, this is like if, I think a lot of like conservatives are against, socialist principles, against communism, against all this stuff. One of the most, one of the biggest problems of socialism, of communism, is a centrally planned economy that controls prices. So we have that in the United States. It's called Medicare. Medicare literally controls the price of healthcare by defining how much a service costs and forces that into the marketplace. Meaning a hospital or a physician is told how much they're going to get paid for a service by the federal government. And that's, 20% of our population is on that. And it's 20% of our sick population on that, our elderly, sickest people, right? At the same time, Medicaid does something very similar. It's very similar, but it's kind of happens at the state level. They do the same type of price controlled situation. So what has happened is hospitals and physicians, because of this distortion in the marketplace, they lose money on every government person. So they lose money on 40% of the Americans out there. So what they have to do is overcharge the private market, overcharge anybody who's not part of this price controlled environment. So your employer-based coverage, your Obamacare, and this is known in the industry as like, what percent of Medicare does your program pay? So typically, if your employer is trying to get access to insurance, they're paying 200% of Medicare. They're paying 2 times the rates of Medicare rates. Why? Because the hospitals are having to react to this price distortion that exists by a centrally planned, federal government. So the first question, does it cost too much? It depends. If you're on Medicare or Medicaid, you have the federal government that has literally forced hospitals and providers to take a loss on your services, meaning you pay too little. Like there's, like even the amount that you've been taxed all of your life, I remember seeing an actuarial report, is half the amount that should be in order to adequately cover Medicare costs, which is why Medicare, we have a problem at the federal level. It's ballooning the cost, right? So on one hand, like you've paid too little. On the other hand, if you're in the private market and you don't have government insurance, you pay too much. You're subsidizing the federal government enrollees, right? And so I think that's what most people, when they say healthcare costs too much, most people are feeling that sticker shock of a healthcare system that's trying to balance out this market distortion of what happens when a federal government price controls. Um, that's the first thing. The second thing is we also don't know what healthcare should cost because we don't have a free market where the people receiving the care actually bear the brunt of the cost and have the choices to decide between A or B, right? So like in a free market, you have to have the people actually receiving the service know the cost, shop, and make decisions, and organically you develop prices. Well, 20% of all healthcare spending falls in this elective payment area where you are electively deciding to pay for healthcare on some level, whether it's electively deciding for premiums or your cost sharing or whatever. 20%. 80% is non-elective. It's passive. You don't even know. Your employer's paying for you. The government's taxing your employer. The government's taxing you. When you're on Medicare, you're not even paying, you're paying just like a little portion of the overall cost. In Medicaid, you have zero cost sharing. So when you have a situation where 80% of the healthcare costs are non-elective and passive, you don't have a free market. So we don't even know what healthcare should cost. It's kind of like if you're a teenager and you're like, your dad basically funds, you paying like for Nikes or whatever, and like gives you like, here you go, here's like $200 to go buy some Nikes. You don't really feel and understand the cost of it until like you would actually have to like get your own job as a teenager and pay for your own Nikes. Then maybe you're buying Starberries from back in the day or whatever, like when it's your money, right? Like, so we're kind of, I think there's part of it is like a sticker shock. And I always use my dad as an example. Like, I use my dad as an example. I remember he had Kaiser Permanente out here in California, and he was like telling me like what he pays. Like, he paid a good portion for our family insurance. He's like, Daniel, I pay $1,000 in premium, you know? And I'm like, yeah, but you think that's a lot of money? You're only paying a portion of that premium. Like, if you were paying the full premium, like, so part of it too is like we're held back from the cost of healthcare. So anytime we interact with the actual cost, it feels massive. Whereas we should think of it as like, okay, it's 20% of my family budget. That would change the way, if you treated it like a mortgage, you would start to think about it a little bit differently. But because we're shielded, partly is the problem. So anyway, does that, if it makes sense to you, Cameron, then we're probably on a good level. But like, market distortion shielded from prices, I think is kind of the first thing to understand.